Good morning and welcome to the Spotlight with me, your host, Advocacy. Today our center of discussion would be on the Kush menace. Looking at the last situational report, we've seen 19 cases being reported, bringing it to 113 cases. Looking at the statistics, we've seen a 20% increase. But joining me in the studio is the Executive Director of the National Youth Council, who for such most of these things are affecting a lot of young people. So he has been in the studio to come and discuss, to come and shed a light on what is the National Youth Council actually doing towards this menace, because of course it is concerning. Before we go further, I would welcome Mr. Alaji Jaju to
Thank you very much, Alu. It's a great pleasure to be here. Definitely discuss quite very pertinent
Thank you so much. Thank you. Obviously, just like you stated, this is a menace that is actually, alarming. If you're looking at the last 3 weeks, it's been stated that 19 cases have been reported, across the region, and bringing it a total of 20% increase. Looking at it, it is in the increase, not on the decrease. So, first and foremost, as Executive Director of the National Youth Council, looking at all the young people that constitute almost 60% of the Gambian population, what is your take on this menace?
Thank you very much. And I think the institution established by the government whatever affects them, especially something that affects them quite negatively, that's the consequence. I think it's quite alarming. When the whole on Facebook, in terms of the damage or the effect it has on young people or its users immediately, from using it. And I think we have, during user platforms, meetings that have nothing to do with actually drug or alcohol abuse or whatsoever, either recreation or a meeting on SRH, but we've used these platforms to find ways and means to really desist from this. But again, at the level of the task force, it's been also doing a lot, in terms of working with cigarette apparatus, just to ensure its country or its soul, having a soul along the streets, is minimized. So I think the task force is doing a lot. But we, at our level, I think it's more of advocacy, the preventive part, that is the task force.
of the advocacy part, we've seen the fertility rate moving to 9.7%. Looking at it, it is actually alarming.
Yes.
And we understand that advocacy is very expensive. Cognizant of the fact that you are given a budget. Now, what constraints would it have, or how do you actually go on your advocacy, knowing fully well that advocacy requires a lot of resources? What steps, what strategies, what means are you going to take to at least, advocate for the issue of Kush?
Yeah, you rightly said it. Advocacy requires a lot of resources, especially when it has to do with an activity that you've not planned for at all. It's usually difficult. But there are various means of activism. There are those that you can do requiring minimal funding, especially the use of our online platforms. Today we've probably within the last 1 hour released a statement, online, raising the alarm of Kush, the danger it's doing, and appealing to young people to desist from it, and also recognizing the efforts that are being done and those that are planned for that to ensure this is addressed. So we are using our social media platforms, which usually you can do at minimal cost. But as I said earlier, we have also used other platforms, that is a funded activity around migration or a funded activity around SRH. Because young people are there, you've taken a minute or two to discuss the issue of drug abuse, or and of course the dangers that it can have. But what we actually want to do is to go out there and organize massive sensitization sessions using different means, either through Bantaba sessions or using sports, as a vehicle or as a driver, attract young people and, certainly, talk to them directly, or even, using people, that were into drug, former drug addicts, and, using them as, avenue to really talk to their fellow young people. But this will require a lot of resources, both material, and of course, financial. It requires that. But we are really looking at ways and means of where do we get these resources. But in the meantime, what can we do that requires minimal resources is what we are doing. And then in the short, to medium term, we are looking at getting other funding from our partners, from government, and so we are able to, further enhance, what we are doing.
Now, you made mention of releasing notice to online for people to on the issue of Kush, but how effective is this? Cognizant of the fact that most of the time the text is written in English, and we have a lot of young people out there, some of them who are not literate, or some of them who do not have access to smartphones or WhatsApp, or even when they do have, but the cost of data in this country is a little bit expensive, so it may take time. Now, what other strategies or means are you taking to making sure that at least it boils down? And again, in your releases, is it also, does it have a context in which the locals are also involved in it?
Yeah, as you mentioned, internet, yes, expensive. Can they read? You'll be surprised that when you go to these ghettos, quite a number of them, they have a smartphone and they can read. But yes, you have the others that equally, have that same problem of not being able to read. But usually when you share these releases on your Facebook platform, you're also sharing with other media houses. And some of them has platforms where it's done in the local languages. So those that cannot read, the release online, when we share with other media houses, we expect that it will be done in other languages, and they should be able to have, access, to, the message that we are sending. But I will agree, usually it does not go as far as you want it. So it's usually the direct interactions, that you have, that usually require cost. So now that you don't have the finances, but again, you can't sit down to it. Something needs to be done. So we're looking at immediate actions that we can do that don't require finance, and that is what we are doing.
When you talk about immediate actions, how immediate it is? Because these things are, the statistics are not, dwelling well. And obviously, just like you said, something needs to be done. how too soon do we see the NYC going out there to engage, communities on this?
I'm sure we'll do something very soon. As a council, we work with our youth groups, and already we have written to some of them. We want to have an emergency meeting on Monday. We don't want to do this alone. We know we work with young youth groups, and these youth groups are present all over the country. And sometimes they probably even have resources that can be used. So we have written to some of them, and we want to have an emergency meeting on Monday.
Talking of which, you talked about having an emergency meeting. What prompted this emergency meeting, and what are some of the issues that you are going to discuss, or strategies that you are going to develop to engage, especially some of these communities that are directly affected with this issue of Kush?
I think the emergency meeting is prompted with some of the data that you are mentioning. The fact that the rates are rising instead of decreasing. So the minimum efforts that we are doing, we are not seeing it bearing the fruits that we want. So now we're thinking we need to escalate further, that the minimum that we are doing is not giving us what we want. So we need to move on to the next level. And that is why we thought of the need to not only do alone, but invite the people that we work with, that is the youth groups, to have a meeting. Now in the meeting we highlight the current problem that we have. And again, look at actions that we can do immediately that require less cost, but also look at actions that we can do in the long term, and also identify potential partners where we think we can have support and good activities, but also how do we collaborate with the national task force already set. One thing we know, we don't want to reinvent the wheel. We know there's a task force. Whatever we do is to really help complement that task force. But we want to bring in the youth angle. And that is where we are having a meeting dedicated to the youth cohort, that is the council together with its youth groups. And we draw out a plan that we think we can also sell to the national task force as to this is what we want to do. We can work together, look for funding, implement activities, but we also want to see with our youth groups what can we do immediately, and not while we're waiting for funding, what can we do. This is something that we also want to discuss with the youth groups. We don't have the answers alone as a council, but we have those human resources from the various youth groups. When we come together, we are quite optimistic. We can come out with actions that we can do immediately, and of course in the long run.
You talked about what can you do without funding, and you understand that sometimes when there is no funding attached, a lot of the time the commitment level to to these activities are minimal, and this is actually stated in the task force committee that they have challenges in terms of resources, which actually is also directly has impact on the commitment of some of their individuals to carrying out these activities. Now, as a council, do you think that coming up with initiative that has no cost attached would be effective in terms of commitment, in terms of dedication to time?
We are hopeful with the current data coming out. We are hopeful is going to motivate a lot of us in terms of what do we do, because the data is not pleasant at all.
Sure.
And we all know it is not pleasant. And it is the young people that we intend to serve. We cannot continue to see this unpleasant data day in, day out, because there is no funding. So I am quite hopeful that when we come together as youth groups on Monday, we will be able to come out with actions that we can do. And I'm quite sure we will be able to implement them. Some of them that we can do immediately without funding. I'm quite sure that with the current data, we will be motivated to really do actions, even without, the needed funding. The data is not pleasant, and I don't think any one of us wants to continue seeing this kind of situation, this kind of reports coming in week in, week out. I think it's really going to motivate all of us, to do a lot.
So obviously, we understand that there are affected individuals and also affected communities, some of which are now discharged, but back to their community. In your meeting or as a council, because you speak for the council,
sure.
Are there any strategies that you have in place to connect with some of these affected individuals and also communities? And how do you harmonize, efforts with the National Task Force Committee to see to it that there is no duplications in what you do, or there is no conflict of interest, because at some point somebody feels like somebody is definitely doing my job, and I will not be happy, and we've seen most of those cases happening in the country.
No, I think, as I said earlier, one thing we know, we will not be duplicating efforts. Whatever we want to do, we will relate it to the task force. But there is a holistic plan, but as young people, this is where we think we fit in into the plan. So whatever we are doing, we will definitely ensure we are definitely communicating to the task force. As I said, we sit as a council, we sit in the task force. So we will definitely avoid that case of duplication, because at the end of the day, it does not help. It ends up into a very unhealthy competition, and I don't think that is what we intend to do here. What we intend to do is to really recognize current efforts that have been done, led by the task force, and we want to see as young people where we fit in the entire equation. And this, after our meeting, we will definitely present whatever we want to do to the task force, that this is what we really want to do, and to also ensure we also avoid duplicating efforts, that we are in SO today as young people, and then the task force is in SO the following day, and at the end of the day, are you even sending the same message? And when you begin to send conflicting message, that in itself is too dangerous. So again, we will ensure that whatever message we are sending is a unified message, that again, avoiding really duplicating efforts, and where need be, in fact, going together as a team, and avoiding going in separate teams. So we will be cautious of ensuring that, in as much as you want to intervene to address the situation, but you are not actually causing harm, instead of actually solving the problem. So we will be cautious of whatever actions that we are doing, that there are existing actions, and we need to feel into those existing actions and not avoid creating some parallel interventions here and there.
Okay, you sit in the task force committee, and obviously anything that is being discussed must have already filtered. Now, we just want to know, aside from the Kush menace, are there any priorities to address other drug-related substances? Because we've seen other substances that are also killing a lot of people, aside from the Kush.
No, I'm sure the task force is definitely, a lot of the focus is around Kush, but of course it's looking at whatever is drug and substance abuse. And if you look at the current arrests that are being done, it's across, you're talking about Kush, but also talking about the different
cannabis
other drugs, be it cannabis or whatever names that they are giving it. Kush is more or less the vehicle driving the process, but I think the task force, or as a country, we're looking at it in its entirety. How do we generally address, the issue of drug and substance abuse amongst our young people? When you go to the field, you will definitely mention Kush, but you're talking general, in terms of how do we get young people avoiding drugs and substance abuse. It starts, it's a process. It starts from either, taking cannabis. At some point, cannabis is no longer enough, and then you add something to it, and then it moves from one level to another. So how do you address it from the beginning? That is, they start with maybe lesser dangerous drugs, that if that term is actually correct, and then move on to something far more lethal as time goes on. So yes, we're saying Kush, but even if you look at the statement that we released, the headline is Kush, but you go right down, we're talking in general, drugs and substance abuse.
Now, obviously, the unemployment rate among young people is not the least encouraging, and
sure,
the statistics are not improving. They are not improving by day, and which actually prompt some of these young people going into this drug and substance abuse, and also selling it. Now, we just want to know, as a council, what have you done so far to engage stakeholders? We understand you have some other initiatives that are geared towards addressing, the unemployment rate, but obviously it seems that those initiatives are not also, matching up to the current situations. Could you take us through what other means, what plans as executive director, to actually see that the unemployment rate is curbed, and relating it directly to the issue of drugs, which actually, is not helping?
Yeah, I agree. I think as a government, as a ministry, over the past years, there have been a lot of drive in terms of addressing the issue of unemployment. And I think in the past, the drive it has been driven by helping to address the issue of irregular migration. That has been the drive because it's related to unemployment. How do you address unemployment to be able to cope, irregular migration amongst young people? And I think several initiatives have been done in terms of, training, young people, providing them grants, providing them loans, to ensure that you get a lot of them out of poverty. A lot have been moved out, a lot have been assisted, but again, you need to understand this country has a large youthful population. When you support probably a 50, 100,000, there is another, probably another 50, another 100,000 or so that are not supported. Yes, you've supported a lot, but you're still having others, and almost, year in, year out, you're having young people graduating, from senior secondary school, from university. So you address, this number this year. Next year, grade 12, you're having 13,000 graduating. That is what is graduating at grade 12, 13, 12,000. I don't get the numbers exactly, but I know it's around that figure, between 11 and 13,000. 2,000, 3,000 goes to university. You wonder, the next number going into other tertiary institutions. So the drive has been addressing youth unemployment, to cope, migration. And as I said, a lot has been done, but a lot more still needs to be done because the number of young people continues to increase year in, year out. And, the resources that we have are sometimes limited such that you are not able to support everyone, that is really coming out of, the system
unemployment. But many actually criticize the way you give out grants and also even your training because they seem to read that there's conflict of interest between NYC, as a body that is actually should be able to just foresee things, but it's like conflict of interest when NYC is implementing activities on behalf of young people when it is supposed to be the other way around. What do you have to say about it? Do you think that that would actually address the current, situations?
This topic keeps coming up in terms of coordination, but if you, I keep referring people back to the NYC Act. We have a role to coordinate, but the same Act also tells us we have a role to plan and implement activities. So you don't look at us in one role and forget about the other role. We have a role to coordinate, but we also equally have a role to plan and implement. And that is why usually in a lot of what we do, we invite the youth groups to be part and parcel of what we are doing. We've had several task forces, technical working groups, and we've always have young people on board just to be able to avoid, some of that duplication. But again, if you look at the drive to address unemployment, a lot of it is actually actions that are done by the partners, and our part has mostly been advocacy. At the level of the ministry, it's like NEDI providing grants, NYSS and PIA doing the actual, hands-on skills training. So what we do is mostly advocacy. If you look at the projects that have passed, that have been implemented by other partners, be it the ITC or GIZ or IMVF or so, a lot of what we have done has been the part of advocacy and helping to recruit or helping to send the message. The direct trainings were always done, by other partners. But I agree, this topic, this discussion keeps coming. But one way we have done to avoid that conflict between the council and the youth groups is ensuring whatever we are doing, even when we form small committees of activities that we can do, we've brought in, the youth groups. When you asked for NECONF earlier, when we're having NECONF, the organizing committee is us and them. The Youth Connect, Gambia that we have every year, we bring them on board. We want to address Kush immediately. We could have sat in as a council and say, okay, what do we do? But we know we are going to do something, but the youth groups will also do something. And we are not trying to avoid a case of, we are doing this, the youth groups are doing that. How do you bring them together to ensure you are able to address, some of these things together? The challenges are there. Yes, sometimes, we duplicate, but we're trying as much as possible to be able to bring all of us together and work together. And that is why we are having this meeting on Monday to be able to really address this current problem that we have. But I agree, a lot of efforts need to be done to address the unemployment rate among young people, and hopefully when it's addressed, it can also help reduce these issues of, drugs and, substance abuse, and others using it as a means of earning an income. They don't necessarily use what they are selling, but they're using it as a means, to actually earn a living out of it, and in the end, harming, someone else that is actually using the product, and you are only selling, not actually using it, as a means of, addressing your unemployment, and in the end harming others. But we hope when we come together Monday, we should be able to agree on what to do, and we will share with you whatever actions that we agree on Monday.
Oh, okay. Coming down now, we look at NACOF is just right at the corner, and the issue of Kush is something that just pop up, and obviously in your budget is not captured. Now, are there any means that you could just fuse part of your budget to making sure that something is done immediately, just like you made mention of? And in your other engagement, especially the NACOF, is there any plans or program or event specifically dedicated to addressing young people, especially on the issue of Kush? And again, how do you work with the enforcement agency to see to that it's not just all about, the arrest, enforcement of the law, but there is at least a dialogue, to making so? Because if you go to most of these, if you go to prison or detention centers, most of them is young people, and it is not helping as young people that has a future to, to contribute to this development of this country, but find them behind bars. What are you doing to at least engage the law enforcement to see that it's not just beyond law enforcement, but there should be community dialogue, to bring young people to speed?
No, I think I will at this point need to recognize the efforts of the Drug Law Enforcement Agency. Through their PRO, they organize lots of sessions in schools or in communities to really sensitize young people. So beyond the issue of arrest, I know they are doing a lot of sensitization on radio. I know we've been invited several times by the Drug Law Enforcement Agency, especially its PRO, that we will definitely have to commend, Sedeba and the team. They go out a lot of the times, to really talk to young people in schools and of course on the streets. So they are doing law enforcement, but they are also doing a lot of advocacy, just to be able to prevent it actually getting to the level of arrest. For the NACON, I know we usually have 10 thematics, and there is always a thematic session, that will fit into the discussion around drugs and alcohol abuse. So as we move on, we should be able to better fine-tune it, to really addressing, the current issue of Kush. And probably, now against December, maybe, during the entire NACON, have a whole day session or a whole day dialogue around, the issue of drugs and substance abuse. I'm sure as we plan and as the issue of Kush keeps coming up, we will keep changing or adjusting our plan to address current realities. Because at the end of the day, the intention is to address realities that are actually current. So even where we've not factored, it was general discussion around drugs and alcohol, we will definitely look at, the possibility of, really bringing in, the topic of, Kush into the session, and possibly having a whole dialogue session, inviting different stakeholders, to have it. But these are plans that we have. It's December. As we move on, we will keep adjusting the plans, depending on, what current issues exist, in the country.
Now,
Yes.
now I made mention of the issue of arrest, and it's going to be my last question, because I understand you have another activity to catch up while
Yes.
we also wait for the task force committee to also come.
Yes.
Now, the issue of arrest, like I said, it's this hardening. Like if you go to most of these detention centers, there are only young people that are arrested on minor crimes, especially the issue of substance abuse and drug. Now, as a council, is that not worrying, and what measures and steps are you doing to engage the law enforcement agency to see to it that, our young people deserve at least a chance to, to reintegrate it back to society, and to be enlightened on the dangers of what do you call it, of drug.
Yeah, as I said, I think the enlightenment is being done. Now the challenge is once they're in prison, what happens? I was at the not mile 2, miles, the juvenile wing of the mile 7 prisons. Fantanka, one of our youth groups, organizes sessions, with the juveniles at the mile 7 wing of the prisons, and I was there and talking to them. Most of them, drug related, cases, and I think the advocacy has been, once they are out, what can they do? And we've encouraged them, to find ways and means of, when they are out, there are several trainings that are happening, especially at the level of the PIA. And I'm happy that Fantanka did call. I think 1 week or so after my intervention, Fantanka called that one of them is like out and wants to go to PIA for training. And I was able to get them in touch with the director at PIA, such that this young guy from prison now goes to PIA. So hopefully if he graduates there with a skill, we are hopeful that, it can address, some of, these challenges. But again, there is a lot of reform happening at the prisons. And I'm sure these reforms, some of them we should be able to address when we have these young people or these children at the juvenile wing. What do we do in terms of corrections? So we are quite hopeful that the reforms at the level of the prisons will address this. But our biggest hope is that they are not even arrested in the first place. But again, the law needs to also take its course. But our biggest achievement will be ensuring that they are not even arrested in the first place, that they are not even into drugs and alcohol, drugs abuse in the first place, leading them into crimes to be arrested in the first place. I think this is the target, this is the focus, this is going to be our activism. Whatever you do, you cannot get it 100%. A few are going to fall, along the cracks. But again, I'm sure the prison reforms should be able to address those that we are not.
Just a quick one on the prison reform. Is there any? Are you people having any recommendation that you need to send to them? Because most of the time the reforms might not be in favor. 1 or 2 or 3 might not be in favor of the young people, and then this issue of not arresting them at all would definitely not come into realities.
No, not as I said. A few are going to fall along the cracks. Whatever you do, a few will definitely fall along the cracks, and they will probably be picked up by law enforcement, and then they end up, right there at the prisons. I know the reforms are happening. We've not been deeply a part and parcel of the prison reforms. In the security sector reforms, we've, really participated in the security sector reform. Really as a council, we have participated a lot in the process. During the development of, the policies and other documents, we've participated, a lot in those. Specifically for the prisons, I know we've not participated much, but I'm quite sure for others that are into those discussions, some of these things, will definitely be looked at and will definitely be factored, to ensure we are able to really avoid these some of these arrests as much as possible. Again, the police with their community policing, recently I saw them in the field, again organizing sensitization sessions. So we hope all of these efforts put together, we should be able to get a lot of them out of, that zone of crime or whatsoever, and then, the arrest will be quite very, very minimal, talk less of, taking them to court or getting them to mile 2 for a year or 2, and which, end of the day, it just retards their growth. Probably they should have been in school. At grade 9 you get them arrested. 3 years imprisonment. By the time they are out, they should have been in grade 12. Now you want to get them back to grade 9. How many of them are willing to go back to grade 9 when they should have been at grade 12? So these are all issues. So as I said, the lesser we get them into crimes, and drugs abuse, the better for all of us. And I think this is, I'm happy that the Drug Law Enforcement Agency is beyond arrest, beyond arresting drugs or crime offenders. They are doing a lot of sensitization. And I think this needs to be recognized.
Yes, one final question that would be, what do we expect from the NYC task force or the outcome of the meeting in the next 2 weeks? What are we going to expect from you? What would we see that the NYC and its youth group are doing to address the menace of Kush in the next 2 weeks? Or
you will see us doing an action in the next 2 weeks. I don't want to preempt what the meeting will agree on, but I'm sure you will see us doing an action or two immediately after Monday. Within the next 2 weeks, you will definitely see us doing an action, and the action that we will be doing together will be as a result of the meeting that we have had on Monday. What are we going to do? Well, I will say for now, I don't know, because we need to agree as as a team. We have our own ideas that we are going to float at the meeting.
Can you just give us a gist of it? Just a gist of it. So at least people will say, okay, the NYC director said this. This is what they're going to do, and we have not seen that happen actually.
I'm sure there will be some massive community sensitization, come what may, in whatever form that will. I'm sure we will definitely agree into organizing some community sensitization in the hotspots. Now, identifying the hotspots, we will have to go refer back to the situation reports that are being done as to where are the hotspots. And among them is definitely the Bara SO North Bank of
exactly.
That is a hotspot, and we will need to ensure that we prioritize the hotspots. The entire country is important, but the report identifies hotspots, and we need to be able to really work on those hotspots as soon as possible. So community dialogues will definitely be done for sure. Yeah.
Okay, so what's finally your last take, obviously, on this event? Just last take on this event, on this particular program, in just a minute.
Of the program?
Yes.
Well, I think is just to thank you guys for the foresight, really bringing up these issues. And as I said, all of us are concerned. I did not call you. You actually called me to say, okay, Guy, I have a TV program tomorrow, and I think you are essential to be a part and parcel of it. The only reason is because of the alarming results that are coming out. So the way it's alarming for you, that is the way it's alarming for every other person. So we just need to really thank you for that foresight, for inviting us, and be assured of our willingness to be available whenever called upon to be here. I'm sure we will be available. So, but we just need to thank you, and of course, the entire network for giving us this space to be able to definitely talk to young people. We know you guys have a wide viewership, and I think it's good to be able to really send out the message. It's part of activities, as I said earlier, those that you can do without funding. So here we are talking to, being invited, talking to our young people, talking to population, without actually, putting in, a lot of resources.
Your message to the young people?
Stay away from substance abuse as much as possible, especially this current one that is quite little, that is the Kush. Thank you.
Well, that was the NYC director. His message is stay away from substance abuse and Kush. But don't go. We will definitely just take a 30-second break, and up next I have somebody from the task force committee who is going to tell us what is the task force committee doing in addressing the issue of Kush. What are some of their challenges, the statistics, the data, and all the work around the issue of Kush, which is actually not helping. Just stay tuned. In 30 seconds, we will be back. Welcome back. After the short break, it was with the Executive Director of the NYC, Alaji Jaju, and now in the studio I have Alaji Jane, who is the Chairman of Upper Gambia, who is directly representing the Task Force Committee on the issue of Kush. Like we stated, the results are not the least pleasing. The rates are on the increase every day. You know, cases being reported are just in the increase every day. So before I go further, I would allow Mr. Jane to actually, you know, Mr. Jane, welcome to the Fatu Network.
Yeah, thank you very much. I'm Jane, the chairman for Upper Gambia Civil Society Organization, representing CSOs and the tax force as the national tax force for substances.
That's great. So, Mr. Jane, what is the primary mission of this task force on Kush, and what specific goals are we working towards combating drug-related issues in the Gambia?
Yeah, thank you very much, and for that question. The issue of Kush, it was discovered here in February.
Yeah.
February, the EDC, that's the Epidemic Disease Control Unit at the Ministry of Health, was informed about the insult of this Kush drug in town. There was a press release by the Ministry of Interior, reference to the sort of this Kush. The rationale was to establish a national task force, which was established, inclusive all forces, chaired by Commissioner Pasamba Bojan, who is the Commissioner for Scientific at the Drug Law Enforcement. You have Commissioner Alaji Kinte from the Gambia Police Force. And of course, you have the PRO, who is also a member of the committee, Moru Musa, from the Gambia Police Force. In the Army, you have Colonel Toure, who is the head of the medic, myself representing the civil societies, and the NCD unit at the Ministry of Health. So it's a vibrant task force. We met and outlined our objectives and our TOR. One of our objectives in twofold. One is to do sensitization on these particular substances, Kush. And also we wanted to conduct a survey to know the prevalences of this substance used by our youth cohort. So these are some of the objectives that were outlined. So we informed the authorities about our terms and references and our objective. We first had a meeting with the IG, recent IG.
Today,
and we also met the GID, that's the Gambia Immigration. We went to SIS, we briefed them. We also have a meeting with the Deputy Speaker, because he's the head of the chairman for the Security Council. So we also discussed with him. So we send letters to various institutions for support, because substance abuse is a global challenge. So you cannot do it without funding.
Now, that is great. I have not heard you made mention of the office of the president. And again, my other question would be, is there any political will, you know, to support this task force committee on the issue of combating Kush and drug-related issues in the Gambia?
Yeah, the issue of Kush, people name it Kush, but in fact the name is not Kush. The scientific name is Cannabis indica. Kush is the name of a mountain between Pakistan and India, where they normally grow this. So this particular substance is a cannabis, but it's different from this normal cannabis that the West Africans youths are using, like this Thai, this Jamba. So this particular Kush have no seed. So, and also it has no scent.
Wow.
You know, so they will use that cannabis indica and mix it with other cocktails and use it. So as a result, it has some side effect related to death issues.
Now, is there any political will to support the task force committee?
Of course, looking at the composition of the task force, it was a recommendation by the chief of staff.
Okay. Now, it could be a recommendation, but then you made mention of having sensitization, and sensitization obviously most of the time has some cost bearing on it. And I understand in the last situational report,
Yeah.
there is a challenge in terms of resources.
Yeah.
How do you do this without resources, or what strategies and means are you putting in place to do?
Yes, as I said, alluded earlier, we have some constraints, especially on financial issues. Because after briefing the authorities, we also write some letters seeking for support from individuals and government institutions, but no response. So we only have few response from few entities, which are private sectors. That is one of the pharmacies, two pharmacies responded. So we use that funding to create awareness, because it was very limited, so we cannot do a countrywide sensitization. So we say this is needful, so we have to go out and do something. Even the vehicles, we requested a vehicle from the vehicle control at the State House. We wrote to them. We sent 2 letters, no reply. So we said we cannot sit down, we have to move on.
Now, what does that indicate if you are writing to some of these institutions that are obviously they are representing the people of the Gambia, and most of these resources that you are requiring for, these are monies or taxes from the Gambian population, and the menace is actually affecting Gambians themselves.
Of course, because as I said earlier, when we met and we outlined our objectives, we draw our budgets, a tune of 1.2 million. Simply because there are some laboratory tests that are included in it, which is very expensive. Because some of these combinations of these schools has to be tested and know exactly what are the issues. Because as of now, the report from the drug law enforcement, we cannot ascertain what type of cocktails are mixed in these schools. So we need to do some tests. We even contacted the ECOMIC, and they are ready to do a preliminary test for us, that is the urine test only. So they have samples that the drug law enforcement is working with partners internationally to see whether they can do this test for them. And that requires funding. Even with the ECOMIC preliminary test, they requested for $1,000 per test, per person. So now, if the drug law enforcement have interdicted 113 people, and we wanted to test that, multiply by 1,000.
Wow.
So the laboratory test is taking the chunk of the money. So we as a task force, even though we are battling with funding, but we at least went out and do 1, 2, 3, sensitization, especially at the POEs. That's the point of entries. We went to Jiboro point checkpoint. We discussed with the immigration, the SIS, inclusive all those forces that are at the POEs. We tell them about these immense of these schools. To my surprise, some of those people don't even know Kush. So how can you arrest something that you don't know? So the sensitization is very, very key, because they have to know it. So there we have to show them the samples. We will not leave the samples there, but they will snap it in their phone so that anytime
how do you come up with these samples, and where do you get the samples?
These are interdicted from the drug law enforcement, people that they interdicted, and they have these things from them. They have the samples with them.
Now, could you tell us a little bit about your collaboration with the drug law enforcement agency, the communities, and also the health personnel or the health department?
Yeah, because looking at the whole scenario, this is, as we said, this is beyond health. So it needs a multi-sectoral approach, all hands on deck. From the media, we are very thankful. Since in inceptions, all the medias are doing whatever they can do in their powers to make sure they create awareness. So the communities, we are talking to the communities, because as task force, maybe if we want to gather 100 people, maybe it will take us some time. But for you guys, you can do it within seconds, because once you share it, a lot of people will see it. This is why anytime we are called by the media, and we are ready to face the media, because they are helping us. But the problem here is government need to support the task force. This is serious. It's a public health concern. Though it's not an emergency, but it's a public health concern.
So, you're saying government actually is not supporting at all in terms of resources that they can easily give out?
Yes, as of now, we haven't received any resources from the government. We wrote to a lot of institutions, from the GRA, from the Central Bank, no response.
Have you tried by any means putting it directly to the Chief of Staff that he could actually relate it to the President?
Yes, I'm sure the Chief of Staff is aware, because I know he will normally
How often do you brief him? Because you said you are sure, how often do you brief him and on some of the constraints that you are actually facing?
Yeah, I know the chief of staff might be talking with Commissioner Bojang because that is the hierarchy there. Because maybe he cannot talk to the task force directly. But I know Pa will brief him, and that's it.
Now, you representing the CSO, and obviously you have an oversight function there, apart from being part of the committee, you know, that you could hold these people to account, to at least give you the funds to go out there and do the community sensitization. Now, beyond, you also work with other people who are part of the security force. Beyond the arrest, what do you do, or beyond the enforcement of the law, what do you do to have the dialogue, engagement between communities and the law and the law enforcement?
Yes, you know, as I said, the task force comprises of different forces, and each of us have its domain. Like for CSO, we can do advocacy, and this is a national thing. We cannot take a lead, but we can support the implementation. So drug law enforcement is there, you know, to interdict people that are using drugs, and of course the police also are there. So this is why the sensitization is very, very important. You know, like the task force, we go out and sensitize the people on the immense of these schools. We tell them the risk factors, the signs and symptoms. Like if you see any sign of symptoms of CUS-related issues, because as of now we cannot tell you this person have died due to CUS. That evidence is not there. So this is why we say CUS-related.
Okay.
Yeah.
Tell us one of the notable successes that this task force, since coming into force, has actually achieved within this short period of time. Notable as success. You've made mention of a lot of challenges, and obviously, somebody might put a question mark as to, you know, the success of this task force. And the other thing again is, are you foreseeing this task force committee surviving with all these challenges that you make mention of here?
Yeah, of course, the task force will survive because, like as I said, it's a composition of different stakeholders. So the Minister of Health is working, and you know, they are giving us the SITREP, that is the situational analysis report, as you mentioned earlier. So we'll use those SITREPs, you know, to distribute widely so that people will know exactly what is going on. Because looking at the SITREP, as of 7th of May, there was only 4 deaths. But after this Toboski, you know, you can see the death rolls have increased to at least to 12. So this sounds something like when gatherings or feasts or programs, you know, so it influenced other people to use these substances. Sometimes it's peer influence, and others is behavioral. So this is why we talking to the, you know, caregivers. You know, we all came from homes, you know. So this is a deadly substance that should be condemned. So looking at the interdictions, like the recent one, as you just mentioned, we have about 97 cases.
I think the last situation report is saying 103.
103.
Yes.
Yes.
The last situation
70 Gambians.
Yeah.
28 from Sierra Leone.
Yeah.
I think 2 from Nigeria, and 1 from Senegal, and 1 from Guinea-Conakry. You know. So obviously, looking at that report, it will drastically show you that this substance was brought in. It's not something that is made here. So we will not say X country or X person is responsible. But if we have to analyze our report, we will say this CUS is coming from Sierra Leone. So this is why our first outing was to create awareness at the POEs. Though we have cross borders, there somebody can escape, you know, but we are doing more sensitization at the POEs and even this garage, especially the Gina garage and other places. So it's going to be very difficult, like a full truck loaded, maybe with groundnut hay. The substance can be inside.
Now,
it's going to be very difficult because sometimes we need to come straight to the point.
But
so can you offload all those ones and they say each bag you offload it and check?
But if actually it is killing this amount, because one life lost is very important, and most of these lives are all young people.
Yeah, of course.
So don't you think it needs the sacrifice for you to go that extra mile, you know, to making sure that it's been reduced?
Yes, we are doing that. Even tomorrow we're supposed to be at Bara and SL, but it was skipped due to some financial issues. So, but by next week we are going there because we have sort of. So we are doing it at our own pace. Government is not responding. That's the bottom line. Government is not responding.
Now, I earlier asked the question of, is this task force going to survive? Because we all have challenging, we all have present issues at both at family and community level, and if you have to use the little resources you have to embark on something that government is supposed to do, do you think that with time it's going to survive the test of time?
Yeah, it will survive, as I said earlier, because right now the only thing that we can do is to do sensitization.
And
so our goal, yes, it needs resources. Like we need fuel to go out. But that one is, alhamdulillah, it is sorted out. The then director of drug law enforcement, Gassama, have sorted out our fuel issues, because he look at our budget and our fuel cost was 185,000, and he said, yes, I will foot the bill.
Personally?
No, the entity will foot the bill.
Okay.
That's the drug law enforcement.
Okay.
So they are doing that. Anytime we wanted to go out, they would give us fuel. So we don't mind. We are not looking for anything like a paradigm or whatever. No. We just want to go out and sensitize the people. In terms of vehicles, we are using some of our men's their vehicles. We hijack Commissioner Kinte's vehicle from the police force. It's a pickup, and one Pajero from Pasamba Bojang. So these are the two vehicles that we are using. And the Minister of Health also, the last time they give us one vehicle. So they will also give us one vehicle. So at least we have 3 vehicles. Even if we don't have vehicle from the government, we'll go out.
Now there's some reports, or let me just say, within the task force committee, some of it is stated that your level of commitment towards this whole initiative is not the least, appeasing or pleasing, in the sense that there is no fun attached to it. The issue of fun then actually still persists in it. Maybe
those are mere speculation, but anytime the task force is meeting, and we always discuss ahead what to do.
How often do you meet?
Even yesterday, as of yesterday night, we were even, because we have a group, and we bring in ideas, and work on it. So even this sensitization that's supposed to take place tomorrow was an initiative from some of the youths against Kush, led by Honorable Musa Suso. So they requested for our collaborations to have men to join them on the campaign, and we welcome them, because one person cannot do it. So if they have other strengths, so we'll collaborate with them. So and the personnel will be there to give them statistics and discuss with the population.
Now, talking of statistics now, what metrics or data point does the task force use to measure the impact of effectiveness in terms of, the crackdown on Kush? And what is your biggest challenge on the crackdown on Kush in this country?
The reports like the CTREPS is a combination of a clinical data and the interdiction reports from the drug law enforcement. So people that use these Kush and eventually, goes to the hospitals. So when they sound them or when they test them, they will see some symptoms of Kush related. So this is how they generated their report, because like there are signs and symptoms, like if you use Kush, then you see swollen tongues, dizziness on them, the tongue want to fall back, because like when you smoke this Kush and you become airy, what's it normally do? Because the muscles that link the tongue will be weakened, So if you want to force to talk, then it will fall back. So that's the time you can see them, some of them, they will say, okay, they will clip it with a plier and so on, so because they are afraid that the tongue will go. So when it falls back, it blocks the airway. So when it blocks the airway, 10-15 minutes, you don't breathe, you are gone. So this is why all the deaths are brought in death. None of them die at the hospital.
Wow. Now, what next? Are there any initiative to connect individuals struggling with substance abuse to resources beyond law enforcement as a task force committee?
Yeah, the task force, because resources is very key. It's very, very key, because without resources we cannot combat the issue of this course here. Because we need to do, as I said earlier, you need to conduct the tests. Well, even drug law enforcement now, they cannot tell you what are the combinations, what are the substances mixed in this course. They cannot test it. There is no lab that you can test these things here.
So, which means you have to go outside.
You have to go outside. You have to send a sample outside to test it for you. It's just like when we are brewing this attire here. We put water, we put attire there, we put nana, we put ginger. So somebody drinks it and you have problem. We say it's attire. But what is the problem? Whether it's the nano combination powerfulness with the attire, or the water has a problem. So you need to test that one and give a correct report to the population.
Okay. Now my other question would be, could you give us statistics as to the amount of Kush seizure, arrests, and also community efforts?
Yes, as I said, for me, I'm a CSO representative at the task force.
Okay.
So the seizures, that is for drug law enforcement,
Okay.
but it's always reflect on the report, the number of kilos that they seize. So it's always reflected there, and I know they have it with them.
So, Mr. Jana, we don't have much time, but how is the task force intending to overcome some of these challenges that you make mention of here, knowing fully well the issue of Kush? The rates are always in the increase every day, and it is not the least, pleasing.
Yeah, definitely. The issue of substance abuse, Kush in general, is very worrying, because looking at the statistics, it's been used by young people, which are the backbones of this country. So if we are to leave our youth to become irrationals, where are we heading to? So this is why it needs a multi-sectoral approach, not only drug law enforcement or the police or Minister of Health. We all have stake in this, even the communities. So what we are appealing to the government to support the task force. Without their support, it's going to be difficult to combat the issue of Kush, and it's increasing daily. Because if you can look at it, humanitarianly, something that you see somebody use it and die, people still use it.
Now, coming from the CSOs, the government not actually willing to support this task force, is that a sign of care on the people of the Gambia, knowing fully well that most of them, all representing them, are being paid from taxpayers' money?
Yeah, definitely. Because honestly, it is under the Minister of it is under the purview of the Minister of Health. But as we said, this is beyond health. So this is why a national task force was formed, so that we can collaborate and support one another. So government should be supported very, very seriously. They have to support us, because the same taxpayers, the same voters that are dying. So if you leave your voters to die, who will vote for you? Or the taxpayers to die?
Does it sound the bells, the alarms for?
Of course, it sounds a bell. So it's very, very needful. So we are appealing to the government. If the president can hear us, we need funding to support the task force, to be able to achieve their objectives. Because this is a global challenge. Sometimes you hear people will say, okay, the drug law enforcement, why not go for the big fish? You are catching the small fish. There is no small fish, big fish in terms of drug. There is a law.
But who is obviously responsible of trafficking some of these drugs into the country? Because we understand it cannot just be a small man like me without connections. Obviously, yeah, that rings the bell as to maybe the bigger fish.
These are peddlers, and they are professionals, and but especially like all these West African surrounding, the Gambia, Guinea-Bissau, Senegal, we are labeled as high-risk areas. In high-risk areas, where it refers as a place where the demand is high and the laws are weakened. So we have to admit that. So that brings in lack of capacity. We have the human capacity, but the support is not there. Because I can test to that as a CSO during this last outing to Daslame, because we understand those are cross borders from Daslame to Dimbaya. Somebody can just escape with these schools. You will not go to the airport, because there are some machines there. I know even in Sierra Leone, you cannot use the course and go to Lingo Airport. If you go there, they will see it. So they will use the back way, going through Liberia, Guinea-Bissau, and use the land. So when you come here, also we have cross borders. Somebody can just enter without going through these POEs. So there should be a constant patrol. And how can they do the constant patrol when there is no vehicle? At the Daslame station, one of the inspectors said, there is no vehicle here. Sometimes we'll hear scenarios, we go there foot patrol, before we reach there you will not see anybody. Maybe the government will give them some of the OIC vehicles that are parked there.
Oh, that's a topic for another day, because I know for sure those ones will not go there. Now, what's your final take on this? Because we're running out of time, and what's your final take on this whole event, and what message would you want to send to the authorities, to the Gambian people, and to the young people especially?
Yeah, before I go to my final message, I would like to sincerely thank the FATU network and other media platforms that we are constantly engaging us on this course issue, because the issue of this course is everybody's business, and we have seen your stand as media personnel on these issues. So on that note, I thank you very much for coming here. And equally, I want to applaud to the task force, because they are doing very great, especially the Ministry of Health, providing us with the statistics, the seat reps that we can share, and of course the drug law enforcement, the scientific unit, headed by Commissioner Paboja. For the government, please, we need support. We need financial support, to overcome this course issue. This is beyond health, so we need a multi-sectoral approach to combat the issue of course. For young people, there is no benefit for using substance abuse, most especially course. It's deadly.
Well, the message is government needs to support them, and if you're listening, this is not just an appeal, but it's something that is needed for, and obviously you have to support us. Well, viewers, that was all we have for you. Join us next time as we also hold to some of these authorities to account. With me, I just want to say Juma Mubarak to all of you. Thank you so much.
All right, thank you.